Hi, I'm Tom Baldrige, and welcome to At the Center. Today we're excited to welcome John Herman, the new CEO of Penn Medicine Lancaster General Hospital. Not only is it a pleasure, in fact, to host John as he starts to learn more and more about our local community, but it's particularly a pleasure on camera today to be able to thank John and his 8,000 plus employees for all they did for this entire community during COVID, which will be covered in part of our remarks. John, welcome to At the Center.
Thanks, Tom. It's a pleasure to be here.
And I want to start there actually with my question. What all has Penn Medicine done during the course of COVID? And maybe what lessons have you learned as a result of that?
Yeah, so COVID is unusual in terms of what it has done to healthcare and to all of our communities. Often, even in things like a hurricane or a snowstorm, or it's short-lived and we go back to normal business. But this has been 15 months. 15 months that has just been incredibly draining on all of our teams. And so they've all truly been heroic in coming in every single day and taking care of their patients and living true to their own personal mission and our mission overall to advance the health and well-being of the community that we serve. We recognized early on that it was important to identify who had COVID. And so we took the lead on doing testing for individuals within the community that were concerned about it. And then went one step further to do the contact tracing to make sure that everyone who was potentially exposed could understand that risk also. And if there was a high risk, that they could quarantine also. Quarantining, wearing a mask, washing our hands, social distancing was some of our first tools. And I think our team took the lead on making sure that people had the information that allowed them to make good decisions. Probably about midway through the pandemic, we started to get some actual tools that could help us, things like monoclonal antibodies and advances that we could do in our critical care. And our team was there not only in the hospital, but in the clinics, providing an environment where patients could come in and could receive the care that they needed so that the virus wasn't able to advance and cause them to become critically ill. And then most recently is the vaccine. The vaccine, I think, is what is saving us all. It's so critically important that all of us be vaccinated so that we can, suppress this virus to the point where we can get back to a normal life. The vaccine wasn't easy to do, and we wanted to make sure that it was available to the masses. And so our team took the lead on bringing together other healthcare providers, working bringing together public officials and public agencies, and then working with Rockelitis to set up the CVC that was over at the mall. And I think in total we were able to vaccinate, or will be able to vaccinate, over 250,000 people in the county. Just an amazing feat on behalf of that team. And I think Lancaster General, through our other clinics, vaccinated probably another 50 to 60,000. So over half of the population we've been able to, through a coordinated effort, we've been able to provide the vaccine. And we're seeing the benefit of it. The incidence of COVID is well below 3%, I think, if I understand the most recent statistics. And I think we're just all fortunate that technology was advanced as quickly as it was.
And as far as people out there watching, it is never too late to be vaccinated, so please do your part to make sure we can get through this pandemic together as a community. Related to the pandemic, John, the next question is really about the future of healthcare. What has COVID done that's going to be influencing the future of healthcare in Lancaster County?
Yeah, so we always knew that a couple things were important for personal health, but I don't think we really understood how important until COVID. Or any person that may be obese, they may have hypertension, and age is something that put them at risk. Doing everything that we possibly can to control that as an individual, I think is something that's important, is within our means. But we also recognize that there's a portion of our population that doesn't have equal access to healthcare because of their financial situation. And so as a community, rallying around those people within our community to make sure that we provide them with equal access and we address the social determinants, the underlying factors that don't allow them to have good access to good health care. So things like access to good food, access to good housing, being in a safe environment. We recognize that portion of our community was impacted even more than all of the rest of us.
And I assume telemedicine is a huge part of what that solution can be.
Yeah, telemedicine was, I think, something we've known about. In 2019, we used telemedicine, or provided healthcare through telemedicine to about 300 people. But we realized the incredible power of it during COVID, and in about 6 months, we provided telemedicine services to over 38,000 of our people, of
That
the
is
residents
incredible.
in our community. So, I think what we learned is it provides an easier way for our patients to get to us, and in some cases a safer way. And we've learned that access to care, and we know that access to care is one of the most important things that all of us need to do to stay healthy.
Thank you. So last question. We have primarily a business audience joining us at this program, and the question is, what can businesses do to work alongside our healthcare systems in Lancaster County to create a more positive health environment for all of Lancaster County?
Yeah, so we know, and all of you know, that having a healthy workforce is really important in order to do our business. And so, business owners, businesses play a critical role, not only in providing health insurance, but more importantly in providing an environment where they can educate their staff on the importance of and ways to reduce obesity and ways to reduce hypertension and ways to reduce stress within their life so that they can improve their overall health. I think some employers have gone one step further. They don't just provide information, but they take an active role in that. And they do it through programs like our HealthWorks program, where we actually can bring a clinician into their workplace if it's large enough, provide a clinical environment so that the staff doesn't have to leave. And that clinician is also there to help them develop and educate on healthy lifestyles. So, I think employers are going to be and are a critical part of our overall health continuum. We learned that during COVID. Healthcare alone isn't able to do that. It takes a village, it takes a community in order to have a healthy community, have a healthy workforce. And so, I think playing an active role is the most important thing that they can do.
And I thank you, John, very much. Thanks for the information, and welcome again to Lancaster County. We look forward to working with you, and thanks again for everything Lancaster General did during the COVID crisis. To everybody out there, thank you very much for joining us. Until next time, stay engaged, stay informed, and stay with us at the Center.